Good morning. I'm Robin Shapiro. I'm the board chair of Health Advocate X, and I'm delighted that you can join us today for this very special talk about the unintentional effects of hearing loss. And we have Dr. Marie Vetter, who is an audiologist, and I am so excited that we're hosting this talk today because I myself have suffered from a lot of hearing related things, as have many family members. And when you start talking to people, you find lots and lots of people are very impacted. So Dr. Vetter is going to start us off with some talking points. And as always, if you can put your questions in the chat, and I might be interjecting as well as she starts us off today. So welcome, Dr. Vetter.
Hi, thanks everybody for attending and inviting me to speak. I've been an audiologist for almost 20 years and I went to the Ohio State University, but currently I have two private practices in Chicagoland. Before I bought my first practice, I also worked at the University of Chicago Hospital. So I have that hospital plus kind of now private practice experience that I hope can help with some takeaways on maybe how we can help patients get some access to audiology care. Audiology is a doctorate level profession. So an audiologist, we non-medically treat hearing loss, tinnitus, but we also diagnose vestibular disorders. So we work with cochlear implants, we work with hearing aids, we are the not physician side of anything with hearing. And so it used to be more masters or the hearing aid aspect. And so audiologists do a lot more than just that. So I think hopefully some of the takeaway too today is that you kind of know what is an audiologist and that we are the experts when it comes to hearing and tinnitus care. So to find and vestibular diagnosis. So if we can, to find a good audiologist when people have this, I think is a big kind of way of getting some access instead of just going maybe the traditional route of a physician. So hearing loss and tinnitus, that you guys are thinking about this topic and is very forefront. The World Health Organization predicts that by 2050, that over about 2.5 billion people will have some type of hearing loss worldwide. Most
Billion.
people think about
With a
people with
B.
hearing loss as being older, right? And so about half of people over 75 have hearing loss. But there's a lot of people, hearing loss is non-discriminatory when it comes to age. Anybody can have hearing loss. It's one of the most common birth defects, actually. And so there's newborn hearing testing for that. Tinnitus affects 25 million Americans. And of that, about 10 to 15% of those have debilitating tinnitus, where it's affecting their quality of life. They can't sleep. So hearing loss and tinnitus are very I think they're reported, but they're very much undiagnosed or untreated. Some of those things can be, right, it's not affecting age, race, any of that stuff. It doesn't matter. It does get more prevalent as people get older because of it can be age related. But is where we find some discrepancies is socioeconomic status and treatment, because Medicare doesn't cover hearing aids. Most insurances don't cover hearing aids. That can be very state dependent. And so you have access to treatment being low, so that people don't even go in for a hearing test because they're like, well, I can't afford hearing aids anyway, so I'm just not even going to go in. There's also a big social stigma. Oh, go ahead.
Can you step back for just a moment and let's just start
Yeah.
with the basics, like what is tinnitus?
Oh, okay.
Yeah.
I was joking with Robin. I talk about this all the time. I kind of forget. Tinnitus is noise or ringing or buzzing in your ears when there's no other external noise present. So people can describe it a bunch of different ways: ringing, buzzing, roaring, cicadas, but it's the presence of noise when no other external noise is present.
And can you also just, for those of us who have not experienced a vestibular issue, just talk a little bit about what that is?
Yeah. So
Yeah.
the ear, the organ of hearing, or the ear organ, the organ of Corti has about the hearing part of it, and then the other part is semicircular canals and two other organs that help with balance or the vestibular system. So we can actually do vestibular evaluations to look at how is the whole balance system working, and is it a proprioception, like your sense of space and feeling? Is it your eyes, or is it your balance? Is it your ear system? So is it a central issue or more peripheral, like your ear? So we can diagnose that. We don't do any treatment, but we can diagnose it.
Perfect. Thank you.
Mhm.
Marie, can you just say like what is considered hearing loss? Like we all like don't hear things, but what is
Yeah.
there?
Yeah. So I think that so any hearing loss is not normal. So you are going to hear that a lot. Well, it's normal for my age, and it's not. I can find a 90-year-old who has normal hearing, and I can find a 90-year-old who has hearing loss. On an audiogram, we say that anything 20 or less is normal hearing. So anything greater than 20 decibels is a hearing loss. Now, is
Okay.
it aidable or not? That depends on the shape and the type. So there's three different types of hearing loss. It could be sensory neural, which is a nerve loss. It could be conductive, which is like more of a medical issue. So maybe an ear. So let me backtrack. Sensory neural hearing loss maybe be from noise exposure or a virus attacking it or age. Conductive hearing loss is more medical usually, and that could be otosclerosis, an ear infection, earwax in the ear. And mixed hearing loss is a combination of the two of them. So, but only about 10% of hearing loss is medically treatable.
Across the
So
board?
across the board. So
Only.
usually,
So you've just said only 10% is
mhm.
treatable. Wow.
And I'm saying like medically treatable, meaning like
Okay.
an ear infect, like a steroid,
Yeah.
a medication, getting the earwax removed. So most hearing loss is not medically treatable or curable. And that's where hearing
Wow.
aids, cochlear implants come in.
Right.
And so when we talk about access to care and some of the traditional pathway for access, when only 10% is medical, makes a big difference.
That's shocking.
Yeah, yeah. And I think with the stigma of hearing aids make me old or hearing loss is only for old people, it then creates an additional barrier because some of it's permanent, right? And then you have access to where to go, and there's confusion around that. And then on top of it, I don't want to be old, so I don't want to go in. And so we as audiologists always say we have a uphill battle before they ever come in. And I think that's kind of the purpose of today, right? I mean, for you guys to get some help with how can we help our patients get better care.
Yes, perfect. So can you take us through a little bit of like the tinnitus treatment pathway, like the typical pathway and from presentation to diagnosis and treatment,
Yeah,
if
so
there is any?
tinnitus, or like I said, noise in the ears. You might get that after like a concert or an acoustic trauma, somebody, or it could just come on by itself. It could be from a virus.
Mhm.
Most people, when they hear it, their brain is able to say, oh, that's some ringing in my ears. I'm going to ignore it and I will habituate to it very quickly. When tinnitus becomes an issue is when their limbic system attaches emotionally to that noise, where it starts to affect focus, concentration, sleep, very anxious, depressed, where they can't function with that. And so some people will come in that it's been for 20 years. Some people will kind of say it happened overnight and I need treatment now. The big problem is a lot of primary care doctors will send them, oh yes, TBI, good one. Concussion, like post concussion syndrome, is a big we see that as a side effect, or tinnitus as a side effect from the concussion or TBI. And then the problem is they
And
will get
TBI
sent,
is
oh, traumatic
traumatic
brain
brain
injury.
injury. Okay, thank you.
And so then part of the problem is they get sent maybe to an ear, nose, and throat doctor, and that ear, nose, and throat doctor says there's nothing that can be done for it, just live with it. Or they go to an audiologist, and I will be the first to admit, before I got into tinnitus, it was like, well, do this and this, and maybe see a psychologist because you're having some anxiety. And they didn't talk about treatment. So then they get more, that limbic system gets more wound up. They get more anxious, more depressed. That quality of life becomes an issue. And so a tinnitus specialist, who is an audiologist who treats it, we will do lifestyle changes. So Apple just came out with a big study this morning. Apple just released, they have been looking at Apple Watch wearers and heart rate variability and tinnitus. So we want people to be active, so getting exercise, sleep, and stress. So we will help them work with that. But then there's the only FDA approved device is called Linear. It's a bimodulation device that they wear some headphones, and they use a tongue tip that stimulates the trigeminal nerve to retrain the brain faster to habituate to it.
So, okay, so a lot of alphabet soup there.
Yeah,
So
go ahead.
can we take a little bit of a step back on that to kind of break down exactly what you're saying for,
Yeah.
lay audience? Yeah.
So a lot of people with tinnitus, if you Google tinnitus treatment, you're going to see a lot of non-peer reviewed stuff. Acupuncture, use these earwax drops, take lipoflavonoids, go do yoga, which all of that might help in a way, but there's never been an FDA approved study device. And so Linear is a device that's from Ireland that has been approved for a few years that retrains the brain for a tinnitus patient to adapt more quickly to the tinnitus. It's not a cure, but it helps them reach their goals faster for where the tinnitus is interfering.
And is it basically like a redirection in terms of where
Kind of, we
you're?
say, like, if you guys think of a candle that's really bright in a room or in a dark room, but when you open the light, that candle doesn't get lighter. It's less noticeable.
Mhm.
So it allows them to focus and some of that.
So diverting your attention.
Yes. Yep. It
And
doesn't make it go away. It just makes it easier. Yep.
that's something that you can access in the United States and
Yes. Yep. There's Linear providers that are certified to do that.
is it FDA approved as well?
Yes, it's the only FDA approved device for tinnitus treatment.
Mm-hmm.
Hearing aids are very effective for tinnitus if they have hearing loss.
Mm-hmm.
About 60% of patients with appropriately fit hearing aids, their tinnitus will reduce.
Mm-hmm.
But those aren't even FDA approved technically for tinnitus, right?
So, I am not as familiar with tinnitus. So is tinnitus progressive, and like once you go to a certain point, will you not be able to regain kind of normalcy or?
Our goal is that you should be able to go back. We've had patients that they go back to their normal life and it goes away and they're done. Other
Mm-hmm.
people have just learned that it's quieter, but they've regained that quality of life.
Mm-hmm.
So our goal for treatment for tinnitus patients, is it going to progress or get worse? We hope not. Will it go away? Probably not. Our goal is for quality of life treatment. Mm-hmm. So that they can go back to work or read a book, whatever that is. It's very different than like hearing loss that could progress. Mm-hmm. And it's more ongoing. Does that make, and part of that is because of etiology.
Say more
because
about
it can, the etiology of it can make such a difference. Is it an acoustic thing? Is it happening over time with age? Was it a one-time experience? Does it vary? Is it Meniere's? And so I think it's so hard.
So Ray asks, are ENTs or audiologists the person who specializes in this disorder? Or how do you find someone?
Yeah.
Yeah.
So I would, that is probably my biggest takeaway that Beth and Robin know about when they've talked with me is everybody thinks go to an ENT, but only 10% of hearing loss and tinnitus is medically treatable. The one takeaway is that if you have a patient or you yourself is experiencing tinnitus or hearing loss, start with a hearing test. Because us doing a hearing test can tell you, do you need to see an ENT? Do you need to go do X, Y, or Z, or stay with the audiologist? It saves a visit. So it's going to be cheaper with insurance. It's going to save you time because most audiologists can get you in sooner than a 6-month wait. And then it just makes it's a direct access to better care faster. An ENT can medically correct it, but most tinnitus isn't medically correctable.
So, and Lee is just again saying, so it sounds like what you're saying is that tinnitus presents in a variety of different ways, can be
Mhm.
different causes, different courses.
It is. It does present in so many different ways. I think for you guys, for people as health advocates, healthcare professionals, caregivers, family members, if somebody has tinnitus, what would be your goal for treatment? And acknowledge that they have it and what would be their goal for treatment. And if they're having a lot of issues, to start with a hearing test and then help them figure out what their goal for treatment is. If it's to reduce anxiety, then maybe that's seeing a therapist who can help with anxiety. If it's sleep, right? So it's so hard to talk about tinnitus because, yes, it presents so differently, a lot different
And
than hearing.
and so going back to a
Yeah,
previous question in terms of the potential progressive nature of tinnitus. So
yes.
does it always lead to hearing loss? Or Robin Layton asks if it is there a way to prevent hearing loss from getting worse if you've already kind of started down that path?
So tinnitus doesn't necessarily get worse or better. It can get better. It doesn't usually progress like it does, like hearing loss does with age.
Okay.
Does that help?
So if you have hearing loss and tinnitus, um,
Okay, then
is
that's a little bit
there
different. Yeah.
is there a way to prevent your hearing loss from getting worse?
Yeah. So for hearing loss, the way to you can wear hearing protection when you're at noise. I've been seeing there's not a lot, tons of studies, but I've been noticing people who take very good care of themselves, right? Diabetes, there's a strong correlation of hearing loss progression and uncontrolled diabetes.
Hmm.
Any really chronic health issue, whether it be heart, cardiovascular. So we say that we want them to try to take care of their whole body, which then can affect that hearing. Flip
Mhm.
side of that, though, if they don't take control of their hearing, you can start to have there's some correlation with some dementia. They get more isolated and withdrawn. So then they don't go out and go walking. So then that affects their cardiovascular. They don't go to the doctor. So some of that progression of hearing loss can't be controlled. That hearing loss can still happen and get worse over time because of age. But if you take good control of your overall health, we see that that can make a difference on how fast it's progressing.
Christine Van Haren asks
Yeah.
about her husband has severe tinnitus and they live 100 miles away from where the nearest partner clinic is.
Mhm.
So is the linear like a prescription? Is it a one and done kind of thing? Or is it multiple visits? How
Every
does it work?
specialist does it a little bit different. If they're linear providers, they only, because it got released in 2023, it was a little bit before that when they released it, they were very strict on only giving it to providers who had a full tinnitus protocol. Like we have another tinnitus provider who does cognitive behavioral therapy. for tinnitus patients. So we had to have more than just for an audiologist. So that's maybe why sometimes that distance is there, because they wanted somebody. But once the person gets fit with it, they use it 2 times a day for 30 minutes a day over the course of about 12 weeks. And then there's periodic check-ins. What check-ins that is, and if they do telehealth, that can depend on the provider.
That's helpful. And is it a prescription or?
So no, because it's not covered by insurance.
Got it.
Can you repeat? It was 2 times a day. What was that?
30 minutes each time.
For 30 minutes for 2 months.
We say about
Okay.
12 weeks. Most people find relief between 6 and 12 weeks. They're seeing some studies are taking a little, or patients are taking a little bit more. The audiology community is pretty tight knit. And so people are starting to share more information. Hey, this one's taking 20. We have some patients at the end, they're like, I'm done and found relief. And other people, I love it. And I'm so calmed and it's helping me refocus on myself that they keep going with it.
Kind of like
I think at the end of the day,
meditation.
tinnitus treatment is really is a lot about self-care and stress reduction. And it's forcing that person to have to sit for 2 times a day and relax and decompress and read a book or do something that's not social media and getting their heart rate up.
Interesting. So can we go back? You were talking about tinnitus and the limbic system, which I'm sure most people online would probably be familiar with, but maybe some aren't. So can we explore a little bit what that means?
The limbics, like that connection.
Somebody asked a question, is this linked to a psychological component always, sometimes?
So that's the hardest part about tinnitus patients. And that's where that expertise of an audiologist who has whether they're board certified in tinnitus or they have some extra training is so important, because the chicken or the egg. Was the patient anxious before and then this acoustic trauma happened, this incident happened, and that's what is kind of keeping that? Or did this tinnitus happen that made them more anxious and now they can't get out of it? It's not a psychological disorder. Tinnitus is a known medical disorder. Is there a psychological component that can happen from it? Absolutely. Most tinnitus providers they've had patients that have had to go to inpatient therapy, suicide. So there is that, but it's not a psychological disorder. I just like to make that clear, but there can be a psychological component to it. And whether that happened first or second, we don't always know, because sometimes we don't see them until maybe they've had it for so long. That they're anxious and depressed from it.
Well, and I have a family member who suffers from this, and my understanding of her experience is it's not just the actual pain, but it is how people treat her for not being able to do things because of the pain that is psychologically wounding, that makes it even harder to kind of heal from it.
And that's what, back to somebody had asked about, do you see an ENT or an audiologist? So many ENTs will say there's nothing that can be done with it, go live with it. There's no cure, see you later. And they don't give them the hope. They don't give them the I understand, because tinnitus is so hidden. And so then they feel so isolated that they start feeling it's all me. Like what you said about your family member. And so that makes it sad, because sometimes by the time they get to us, they have been to 3 or 4 places. They're just struggling so much, and all they want is for somebody to listen. And tinnitus audiologists have to sit and listen, because we have to know what's going on. To tell you the truth, I actually don't do tinnitus treatment. I'm the owner, and I have 2 providers who do it, and their appointments are over an hour long, because we have to see what does the patient need.
So, do all audiologists treat tinnitus, or is there a question that you can particularly ask if you're checking out an audiology provider?
Yeah, that's a really good question. I think I would say, do you treat tinnitus? And if they say yes, we do hearing aids, or what type of that's
Mhm.
one little part. What tinnitus specializations or extra tinnitus treatments do you do beyond just treating typical hearing loss and tinnitus from age? The American Tinnitus Association, Chloe was going to put it in the chat box, is a wonderful, wonderful resource for professionals. Um, it's a wonderful resource for professionals, for patients. It shows research. You can find providers on there. So that's where I would say it would be great. And I just saw a question pop up about go to the American Tinnitus Association because most of the members there are audiologists that treat tinnitus. They wouldn't just join just to join.
Mhm. Yeah. And so Chloe's just put those resources in the chat. Thank you,
Great.
Chloe. And is, you know, what are the ways that people can actually vet the audiologist? Because I think most people start with an ENT, their primary care says go to the ENT, and you're struggling with something and you're like, okay, I guess I'm going to go to the ENT. So this new information about maybe even starting with an audiologist. So what are some important tips in terms of vetting the audiologist?
I so when I have to refer a patient maybe to another state, they're moving, I try to look at, are they following best practices? They do more than just selling hearing aids. And I think a lot of them do that. They try. Um, I will always advocate for getting to find a private practice and
Mhm.
independently owned, just because I think this is my bias, but it's easier for us to be able to help that patient and get them in more quickly than a big hospital system. Um,
Gotcha.
but how long have they been around? What are some of their Google reviews? What do patients have to say about them? What other care do they do other than just hearing aids? Those are some of the ways I kind of like to start and look at it.
Hmm. And can we also just touch on, you described the vestibular system at the
Mm-hmm.
beginning of this talk, but there was a question about, is there a connection between tinnitus and vestibular system? Is that something that should figure into somebody's questions as they're, trying to sort out their diagnosis?
Yeah, I think so. Some disorders like Meniere's disease can have tinnitus and vestibular issues and hearing loss.
Hmm.
Some don't, though.
Hmm.
But an audiologist who does vestibular and tinnitus and hearing loss, they're going to be much more comprehensive and probably look at that patient a little bit more holistically than just hearing.
And are there audiologists that don't have the specialty of the vestibular system in addition to, I mean,
Yeah, I'm chuckling because no,
okay.
this weekend, one of my audiologists sent me some vestibular stuff, and I was like, "Yeah, I haven't done that in 15 years. You got to tell me what you are finding."
Yeah, yeah.
So, kind of like any professional, right? There's
Hmm.
also we have a huge scope of practice,
Hmm.
and we can do a lot of stuff that not every audiologist can always do everything. But there's a lot of practices that have people who are specialists in each of those.
Hmm.
So.
Okay, so just asking about
Yeah.
vestibular
Or, hey,
tinnitus,
I
what's it?
have this disorder. If not, where else could
Hmm.
I go? You
Hmm.
hope that they have a network that they can say, hey, I don't do vestibular, but go down the street to X, Y, and Z. Now,
Yeah.
I also get it that you might be in a rural area where there's no vestibular audiologists. And so then that can pose an issue too.
Is there
Right?
is there a place to vet for vestibular credentials, or like
There is,
through?
but you know what? I
Okay.
didn't give as many because since I was talking more about tinnitus and hearing loss,
Right, right. Yeah. Okay.
and there's some board certifications that they can have. The American Academy of Audiology and the ADA, the American Doctors of Audiology, those have them, and I think you can look them up by specialty as well.
Okay, so the resource American
Yeah,
Academy of Audiology, which is in the chat,
yep,
is someplace that you'd be able to sort for that.
yep,
So that's great. Thank you for that
yeah.
resource. We did have a question about how much the linear device costs. Do you know? 'Cause it's not covered by
Yeah, I would
insurance, so.
say on average, you're looking at about $4,500 to $5,000 with the device plus care.
Mm-hmm.
And I will say that that treatment cost is about the same as what hearing aids cost.
Mm-hmm. Mm-hmm.
That goes back to the first thing I talked about of SES, socioeconomic status and access, because insurance doesn't cover linear, it doesn't cover hearing aids, right? And so
Yeah.
that access to care is a big issue, or access to treatment.
Yes.
Yeah,
So,
and there's a lot of people that just go to Costco or just go purchase them because they don't want to, get
Right.
the costs too high by going to a
Yeah.
specialist. And yeah.
But I will say on the flip side of it, a lot of people say, well, Costco's $2,000. Some audiologists, we do it. Like we have some, because we do some stuff for one of our hospitals that don't take insurance. And so we have a program that we will figure it out. Some have 501(c)(3). We've partnered with our local Lions Club. So I want patients to also know, or you guys as health advocates to know, that it's worth also asking. A lot of state Medicaid programs will cover one or two of them. The problem is the wait time.
Yeah.
So that's a big issue. We were very lucky enough. I did some advocacy stuff for our state academy, and we were able to get our insurance companies to require that they have a hearing aid benefit.
Great. Amazing.
And we are very, very lucky for that. So Illinois is a minority. There's not a lot of states that are like that.
So we have some questions regarding Costco and hearing aids and whether or not audiologists at Costco are board certified. I didn't even know they had audiologists. So you can talk a little bit about.
Well, let's back up. An audiology is a doctoral level profession. Some of the older ones may have been grandfathered in as having master's level, but we are university trained professionals that study more than just hearing aids, right? What we've all been talking about for the past 30 minutes about. There's hearing aid dispensers, hearing instrument specialists, and those are usually who are employed at Costco. Yes, they are board certified because they had to take a test, but that's not a board certification like a medical physician board certified. That means that they just passed a test. We don't, in Illinois, we don't even have to take that test because we're audiologists.
So it's just a lower level of information.
Yes. Yeah. So most Costco, and a lot of them, some Costco can be driven by commission, some not, but most of those are hearing instrument specialists. They're not audiologists. So then they'll refer to us if they need, or if they'll say, I don't know what to do.
Yeah, got it. And what do you think of the hearing aid brands that Costco offers? And I know we haven't talked a lot about hearing aids, and I know it's super controversial, especially among partners, like you can't hear your wife, husband, partner. Because of all that stigma. So how can you kind of take us through what the barriers are, and then maybe how it's so expensive? Like, how do you decide which ones are best?
Yeah. So let's back up a little bit. Quality of life issues are a big component for people with hearing loss. There's more and more studies that come up that are to support the risk of dementia can be higher. I think there's two hypotheses. One, you're using brain power to hear when you should be using it for other things. The other part is you get more isolated and withdrawn, so then you're not stimulating your auditory system as much as you should, or just your brain in general. Safety issues. So if you have patients that want to live alone and they can't hear the doorbell ring, or that, we also want them to be able to live as independently and safely as patients can. So I always say hearing aids are a way for you to try to live younger rather than prevent cognitive decline, right? Because it's more, how can I keep you as active as possible? It will help you with health. It will help you with overall. And so some people, most people, it's a gradual change over time. And so people like spouses, grandkids will see that change before the patient will. And so I always say most patients, they say about 50 or 55 should go in for a baseline hearing test. That's kind of a good way of like, oh, they met them, they know them, oh, they're really nice. Now I'll go back when I need it. I always say you got to meet the patient where they are. Sometimes we don't talk about cost. Sometimes it is just going and getting a hearing test and say, just start with the hearing test and let's see what we need to do. Because cost can be a barrier, but there are now OTC hearing aids. There are things, the Apple AirPods can be converted into a hearing aid. And some people need that to see like, whoa, I am hearing better. I can use these. And then if their hearing loss gets to be too much that they need a prescription hearing aid because they have more than a moderate hearing loss, then they come to us.
So
So
over the count, you said
yeah,
OTC,
over the counter, OTC, over the counter hearing aids.
non-prescription hearing
Mhm.
aid, and that's appropriate for people that have
With
a
mild
minimal.
hearing loss,
Okay.
minimal to mild hearing loss. Yeah.
And so if you go to an audiologist and they say you have minimal hearing loss and could be benefit from that, I've never even heard of over the counter. So can that, if you have an over the counter, would that help keep hearing loss at bay?
It will keep, so untreated hearing loss, we see that it takes longer for a patient to then get used to hearing aids and they need them when their hearing loss is worse. It can also keep their word understanding. It keeps that brain more active. As that word understanding goes down, it then is harder for that patient to adjust to hearing aids. So we say any stimulation, appropriate stimulation is what's needed. So over the counter, if you really only have mild hearing loss, an over-the-counter hearing aid is very appropriate, and we actually give that as recommendations sometimes. You'll see that quite a few of actually, do you have an Apple iPhone? Okay, yep, go get the AirPods. They're $200, try them, and situationally you can use them or all the time. But then when you notice you have more hearing, then you would need prescription hearing aids. And then if the hearing aids don't work, then that's when we sometimes talk about like cochlear implants or something like that.
Yeah. So at what point do you move from hearing aid to cochlear implant? And what is the implant for people that might not be familiar?
Yeah, so a cochlear implant is for somebody whose word understand, they usually have a moderate, severe loss or greater, it depends on the shape, and they have to have a less than 60% word understanding. So if you were talking in 10 words, they got less than 6 of those that they knew. And then we do speech and noise testing to see how they do in quiet versus noisy situations. But it is a medical device that an otologist surgically implants into their ear, and then they wear an external device outside their ear. Those are usually covered by insurance. There are some very strict guidelines to get those approved, but the surgery and the device is usually covered by insurance. But it's for somebody that is having more difficulty with understanding. So we say it's the patient that's frustrated with their hearing aids and they can never do well. And that's kind of the advantage of, we'll get referrals from Costco where we'll see patients like, hey, now you're not doing well, you need to do a cochlear implant. And there's cochlear implant specialists. Not every audiologist does them.
Yeah. Can you talk a little bit about the Costco brands and maybe what the difference, since there's such a cost difference?
Yeah. So there's only 6 big main manufacturers in the world for hearing aids. Costco buys in quantity, right? I'm a small office. So that's why their costs are that's why they're so low. The brands of their hearing aids are usually locked, meaning that you can only go to a Costco provider. So that's why some of the brands are actually parent brands we fit, but they have relabeled them different names for Costco, and we cannot fit them. We can't make changes to them. It's a different chip, maybe by a little bit. They are good hearing aids. I think back to, are they appropriately fit, is always my key takeaway. Only about 20% of Costco wearers go back there for the second set.
So
Because I think there's a quality. Sometimes people are like, okay, now I need some extra, or now I need a cochlear implant, or now I need a custom ear mold. And theirs is more about quantity in a transaction versus sometimes a relationship.
and what did you mean about a second set? Like
If they, so a hearing aid usually lasts about 5 to 7 years. So that's the other
oh,
thing. Hearing loss
whoa,
treatment is expensive.
holy cow. I
Yeah,
didn't
that's
know.
why direct access for insurance companies and coverage is such a big thing
Mm-hmm.
that we struggle with.
I have, Maria, I
Mar-
have a question. I have a very dear friend who lost hearing from antibiotics when she
Yes.
was a child. So is that nerve? Like, so she, I mean, she can't hear in that ear, and it's been since she was a little girl, and she hasn't gotten a hearing aid because I think she thinks it's not going to work. So I'm just curious.
And it might not. So we don't just look at
Okay.
the beeping sounds, we also look at word understanding.
Okay.
So, and that's kind of where that whole cochlear implant thing comes in. And if word understanding then gets to be too poor and they haven't had anything in that ear for 25 years or 50 years, a cochlear implant might not even be as beneficial.
Hmm.
So it's more hearing aids, cochlear implants. It's not a put it on and see you later. There's a
Yeah.
lot, there's counseling that's involved, but there's also expectations that are involved.
Yeah.
And so then that can make, that kind of muddies the waters a little bit more too.
Yeah.
There's a lot of if, ands, or buts.
Yeah. And Marianne Keene
Yeah.
asks, do cochlear implants reduce natural hearing?
So it's all, so do they lose the rest of their hearing that they had? Usually, but now we're seeing a lot of preservation. Some of these otologists are getting really good at surgery, and the surgical things have changed that it does keep some of their hearing. But usually their hearing is so poor that
Mhm.
they're willing to risk to take that rest of what they have so that they can get access to sound. It's all about
Yeah.
access to sound.
Yeah. Um, so one of the learning objectives for today is finding compassionate language that helps people, encourages people who are hesitant about seeking help, push them over the push them over the hill in terms of what that is. Can you talk a little bit about for advocates or family members who work with somebody who might be hesitant?
Yeah. Somebody with hearing loss goes through the same 5 stages of grief as losing a loved one, having a traumatic event where they have to grieve that. And so
Interesting.
sometimes, yeah, so that's why, but somebody might be in the avoidance stage for 20 years or the bargaining. And so sometimes you have to kind of figure out, if you can figure out kind of what stage they're in, right? You want them to get to acceptance that they'll take hearing. And some people do that stage in a day. Some people do it while they're literally sitting in our office. But those ones that you feel like you're pulling their teeth to get them in, right? Everybody, and I think for some there are they, oh, now I'm going to feel old, right? So what's the motivator? I always say, I'll go with you and let's just go get a hearing test and see where you are. You don't need to make any decisions today. I hope that the audiologist that you guys go to will be nice and say this provide some education, some reasons why it's important to seek treatment, and then gently encouraging that patient on their way, on their journey, so that you guys can. I'm noticing some of the other verbiage that sometimes I will say is, when I did it with my own grandpa, but grandpa, you're sitting there, you're not engaging, and I want you to be young. I want you to talk to the other grandkids. I want you to get care, because I want you to stay as young as you can or as active as you can. Some of the quality of life issues that, for some of you guys, I know all of you guys with health that do health advocacy are in a wide variety of places, but our goal, I think, one of the reasons that I was excited to meet you guys, I think some of your guys' goals are the same of we want patients to be empowered. And when they can't hear, how are they going to make decisions that are about anything about their treatment? I had a patient whose mom, or she became my patient, who one of my friends, they were making huge decisions for her dad, for her husband, and she wasn't hearing any of it. And her son was getting very frustrated and said, please just go see my friend. I want you to be involved. So that, especially if you see them not responding, we've had some patients that they said we had family members thinking that I had some Alzheimer's or dementia, because they were answering wrong. But getting a test is the first step. They don't need to make a decision that day.
What is the average out-of-pocket cost for an initial visit for a hearing test at an audiologist? Is there like average cost? It's generally not covered by insurance.
Well, hearing tests should be. Medicare covers one hearing test a year. If you have a referral from a doctor, they will cover it. Otherwise, we now as audiologists can use a modifier, so they don't need a doctor's order anymore. And all commercial insurances pay. I would say we charge about $100 for a hearing test. I know some university, like hospital, charge a lot more, but insurance covers that. So that's the minimal part. It's the treatment.
Yeah. The treatment's so expensive. So would an audiologist or an ENT be the professional to determine whether a cochlear implant is appropriate?
So it's both. So the ENT medically determines that they surgically can go through the surgery and they surgically can have the cochlear implant, but the audiologist does all of the testing to audiologically make sure that they're a candidate. So what's their word understanding? We do the activation of it. Other than the surgery, that's all the ENT does. The audiologist does all the rest, the follow-ups, the mapping, the reprogramming of the device.
Interesting. Going back to, well, I know that in advance of this talk today, there were some questions also about vertigo, because a lot of people who have tinnitus maybe also have vertigo. And so when you're on your ear adventure of trying to figure out what's going on, can you talk a little bit about vertigo and what that is, how it's related to tinnitus? Do you have to worry about hearing loss when you have vertigo? I know it's very impactful. I've had it myself. Ended up being a vestibular issue, but took a bit to get diagnosed for sure.
Yeah, I think, and to tell you the truth, because I'm not a vestibular audiologist, until I bought the second practice that has a whole vestibular clinic that I'm learning even more about, I would usually say, you're dizzy, go to this person. And I didn't even realize a lot of patients, so vertigo can be like the room spinning, but a lot of people don't say it can be the room spinning, but it could be, I feel like I'm on a boat and I'm rocking. I feel like I just feel off balance. That dizziness word or vertigo can mean so many different things. So it's hard. So a lot of people, primary care physicians will send them to an ENT, or they'll just send them directly to physical therapy. Vestibular audiologists you wear goggles and we can look at different reflexes of how the ear brain connection is working to figure out where is the exact issue, so that then the physical therapy can be more effective more quickly. So that's where you might see a vestibular physical therapist or a vestibular therapist. They specialize in vestibular therapy after like we do a hearing test. Vestibular disorders.
So they may or may not be part of the audiology practice. They may be their own
thing. Yeah.
Gotcha.
And not even every ENT specializes in dizziness. So it's hard. There's not a lot who do it.
So we have just a few more minutes here. So want to make sure that we covered everything that we said that we would cover here. Is there anything else that you would like to kind of summarize in terms of ear health and making sure that people that are facing different ear issues know about, have language to get treatment, diagnosis?
Yeah, I think that in the one last thing that maybe I should have even had as a key point, looking at your patients, talking to them so that they can see your face, talking slowly, not just loudly, asking, I'd always tell my patients, rephrase things or ask people to rephrase instead of just saying, huh, or what. I think people in the days of Epic now or online charting in the medical community, physicians are talking to them, backs facing them, and they're not ever looking. So to make sure that they understand what they're hearing or that they're even hearing it, I think is a big way for you to empower the patients to make sure that they're getting everything out of it they can, giving them written materials, but encouraging them to even just get a hearing test because untreated hearing loss does have an effect on their quality of life.
Mm-hmm. Using the teach back method to make sure that they're comprehending
Yeah,
things. Yeah.
yeah. I think that's it's an easy takeaway. I tell our patients all the time, we do some oral rehab of like sit in a booth against the wall rephrase, sit in a booth against the wall at a restaurant, get their attention, know about current events. Those are easy things that even if you have hearing loss and maybe you aren't wearing hearing aids to even start implementing into your own habits,
Mm-hmm.
help.
Yeah.
Oh,
Go
and
ahead.
advocating for use of microphones in
Oh,
public places.
I
It's
have a
amazing
real
how many people
quick
don't.
question about,
Yeah.
so I'm a big swimmer and I've had, water in the ears problem, and I had custom made earplugs made, and it
Yeah.
has changed my life. It was the best thing I ever did for swimming. But if you get water like that, does that affect your hearing over time?
No, it shouldn't.
Okay.
No. But yes, custom hearing protection, like for concerts or big concert goers, there's custom sleep plugs. But yes, we also do custom swim plugs too.
They're great.
Yeah.
So there's a question here. So are you saying to put your phone on speaker instead of using AirPods?
Not necessarily, because AirPods are it's bimodal and it's going into both ears. So I say AirPods are actually probably better than a speaker because you're hearing them in both ears and there's no other noise around. So you're not competing with that extraneous environmental noise around you.
So I know that there's sometimes also if you have hearing problems,
Yeah.
what I've heard from family member is keeping a hearing device in all the time is sometimes bad for your ears. Can you talk a little bit about that?
As long as you aren't, that they're not turned up too loud,
Mm-hmm.
you should be totally fine to wear something all day, every day. Now, you don't sleep, swim, or shower with hearing aids,
Mm-hmm.
but even AirPods, you can use them all day.
Hmm.
There's
Interesting.
nothing wrong. That doesn't hurt your ear.
That's great. And then you said at the top of the hour
Yeah.
that Apple just came out with a new study.
Yeah.
Did you I don't know if we have access to that, but are there any kind of top takeaways from the study that they
So it had showed that the Apple Watch wearer, about 77,000 patient or people that wore it, heart
Mhm.
rate variability directly was related to tinnitus sufferers. So people who had better heart rate variability had less tinnitus or less annoying tinnitus than those that didn't. So if you exercise, is kind of what they show, hopefully you have less stress that you can.
Mhm. Gotcha. And so Roseanne has asked, what's the best you can expect from a hearing aid? She wears them and have had many types. And there's not one that really gives her great hearing.
Yeah,
So
that's actually a
expectations,
really
yeah.
good question. I always say
Mhm.
that hearing aids are aids. They're not
Mhm.
fixers. They
Mm.
aren't curing. You're still going through a damaged system. So you're still going to have trouble in really noisy situations or in a big auditorium or church or a large gathering. And that's where that extra part of using good communication strategies and advocating for yourself makes a big difference. So I say you should do a lot better one-on-one and in small groups, but hearing aids are aids, they're not fixers.
Yeah, that's a good one. And I know that some of the systems now have adaptive AI
Yeah,
that also kind of adapts to the environment, which is
yeah.
pretty interesting.
When I always say like what your hearing aids were 10 years ago, for sure 20 years ago, are not the hearing aids now.
Hmm.
They
Hmm.
direct connect to phones, they're rechargeable, they automatically adapt. There's a lot of AI features. So some of your patients might think like, oh, well, my dad had one 20 years ago. That's a
Hmm.
whole different world
Yeah.
now.
Not your father's hearing aids.
Right.
So, Marianne, you have a question about a best treatment for excessive curumin, but I don't know what that is.
Oh, cerumen.
Oh, cerumen. I've never heard of that word.
So as you get, that's wax, that's the fancy word for wax,
Oh, okay.
earwax. As you get older, you develop less oil, right? All of
Yeah.
our skin gets drier, and so that cerumen or the earwax can get drier over time. There's not really an effective treatment other than having to get it removed, usually by an ear, nose, and throat doctor, because insurance will cover them, even though
Yeah.
that's in our scope of practice, we can't bill for it. So
Gotcha.
there's not good treatment.
Darn.
I know, because it's an easy one.
Yeah. Well, thank you so much, Dr. Vetter. We really appreciate you taking us through
Yeah, thanks
all
for
the
having me.
ins and outs and appreciate also the good resources. So delightful to talk to you and may have additional questions coming your way.
No
So
problem.
in the future. So thank you so much. Thanks for
Yep.
joining us for another community conversation. And we will be having another presentation next month on the disease of addiction. And so that will be August the 11th. So hope you can join us for that. Okay, take care, everybody. Nice to see you.
Bye.
Bye.